You know, they say it will take years before we can truly understand the impact of COVID-19. Well, we are still in the middle of the pandemic and we are looking at some very scary consequences of the pandemic. Take, for instance, this news from Europe. Experts are warning that Europe is now staring at a cancer epidemic, that the continent could have missed as many as 100 million cancer screenings in the last 2 years. 100 million. The obvious question is how? You see, ever since the pandemic struck, most healthcare resources have been deployed to combat COVID-19. And when I say resources, I mean doctors, nurses, researchers, basically every person working in medicine. In the last 2 years, COVID-19 has become their priority, and cancer patients have suffered because of this. Researchers say, and I quote, "There is emerging evidence that a higher proportion of patients are diagnosed with later cancer stages when compared with pre-pandemic rates as a result of substantial delays in cancer diagnosis and treatment." So how did researchers come to this conclusion? Through numbers. Clinicians saw 1.5 million fewer cancer patients in the first year of the pandemic. What's more, 1 in 2 cancer patients was not receiving surgery or even chemotherapy on time. At least 100 million screenings were missed. And experts say that some 1 million Europeans could now be living with undiagnosed cancer because of this. But the story is not limited to cancer, nor is it endemic to Europe. This pandemic is bad for healthcare in general. We all know this. Appointments were missed during the lockdown. Surgeries had to be cancelled. Some operations were tagged essential, others were put on the back seat. But who do you blame? We all know hospitals were stretched for resources. Lockdowns had limited the mobility of all healthcare professionals and patients. As early as 2021, dentists in America were raising an alarm about a dental health emergency. One report published in April last year found that 6 million American adults lost their dental insurance during the pandemic, and 10 million delayed getting care. Some because of costs, others because of a lack of infrastructure, and of course, a fear of exposure to the virus. In many cases, the consultations moved online, but clearly, many patients were left out, including mental health patients. On the 5th of October 2020, the World Health Organization put out this report. It said, the pandemic has disrupted or halted critical mental health services in 93% of countries. 67% of countries reported a disruption in counseling and in psychotherapy. 35% reported disruptions to access for medication for mental disorders. Guess what else suffered during the pandemic? Our eyes. Doctors in India say 90% of their patients saw some degree of vision. They saw some degree of vision during the first 2 waves of the pandemic lost. I'm sure you're wondering how. Well, doctors say it's because of poor follow-up. Patients missed taking critical injections. They had to skip their eye checkups. You see, in case of most of these illnesses or diseases, early detection is the key to controlling them. They say prevention is better than cure. So be it an eye disease, a dental problem, or cancer, you must have heard doctors say that the sooner we detect, the better it is. And this is where the pandemic became a hurdle. It came between the patients and their regular checkups. It came between doctors and early diagnosis. WION World is now available in your country. Download the app now and get all the news updates on the move.